As a urologist, I am frequently confronted with claims about miraculous solutions for male vitality, and my default position is always deep skepticism. However, there is a specific physical manipulation, a simple biomechanical reflex that takes about 10 seconds, that genuinely surprised me when I first reviewed the hemodynamic data. It is not magic, and it is certainly not a gimmick. It is a precise activation of the pelvic floor circuitry that forces an immediate surge of blood flow into the local tissues. What shocks most medical professionals is not that this reflex exists, but rather how completely it has been forgotten in modern clinical practice. We have become so conditioned to writing prescriptions for synthetic pills that we entirely ignore the physical infrastructure of the male body. Men are walking into clinics asking for chemical interventions when their basic muscular and vascular pathways are completely dormant, tightly constricted by tension and lack of targeted stimulation. I know exactly why you clicked on this video. You are likely dealing with a progressive loss of spontaneous rigidity, a frustrating decrease in local blood flow, and that sinking realization that your body is no longer responding the way it used to. I see thousands of patients who walk into my office silently carrying this exact burden, believing that they are uniquely broken or simply too old. I want you to stay with me until the end of this explanation. Today, I am going to break down exactly what is happening inside your vascular system and show you how to manually bypass this blockage, providing you with the clear, clinical understanding that standard 15-minute medical consultations simply do not have the time to cover. To understand why this 10-second physical intervention works, you must first understand the true mechanical nature of your problem. When we talk about fading blood flow and the inability to maintain rigidity, we are not just talking about a lack of desire. We are looking at a profound failure in the local vascular delivery system. Your pelvic region is supported by a hammock of muscles, the most critical of which is the bulbospongiosus muscle. This muscle wraps around the base of the tissue and acts as a mechanical clamp. When blood flows into the area, this muscle must dynamically engage to trap the blood, creating the pressure required for sustained rigidity. However, due to chronic sitting, systemic stress, and localized inflammation, this muscle becomes rigid, fibrotic, and exhausted. It loses its elasticity. It acts like a clenched fist that simply cannot relax enough to let the required volume of blood enter, nor can it contract sharply enough to keep it there. The conventional medical approach completely ignores this mechanical reality. When a patient reports poor blood flow, the standard procedure is to prescribe a synthetic vasodilator. These medications force the smooth muscle in the arteries to relax, aggressively pushing blood into the tissue. But here's the limitation I see constantly in my practice. If you push blood into a system where the muscular clamp is weak, or where the surrounding fascia is chronically tight, the blood simply drains right back out. It is like trying to inflate a tire that has a compromised valve. Research published in prominent urological journals, such as the Journal of Sexual Medicine, repeatedly highlights that without pelvic floor rehabilitation and local hemodynamic responsiveness, systemic medications eventually lose their efficacy. The most frequent mistake I see men make is relying entirely on these pills while allowing the local musculature and connective tissue to atrophy and freeze into a state of chronic tension. This brings us to the biomechanical intervention itself. The 10-second technique is a form of targeted myofascial release and neural stimulation focused directly on the perineum. The perineum is the physical space located exactly between the scrotum and the anus. Deep beneath the skin, in this precise area, lies the central tendon of the perineum, the convergence point for the bulbospongiosus muscle and the pudendal nerve, which is the primary command center for pelvic sensation and blood flow. By applying deliberate, calculated pressure to this exact focal point, you initiate a reflex arc. You are mechanically forcing the chronically tight fascial tissue to yield, which instantly relieves the physical pressure on the pudendal nerve and signals the local vascular network to dilate. Here is exactly how you execute this. You must be in a relaxed, seated, or reclined position. Using the pads of your index and middle fingers, locate the center of the perineum. You are going to apply a firm, steady upward pressure. This is not a massage. It is a sustained ischemic compression. You hold this precise upward pressure for exactly 10 seconds. During these 10 seconds, you are intentionally cutting off the superficial microcirculation in that exact spot. When you abruptly release the pressure after 10 seconds, you trigger something called reactive hyperemia. The body responds to the temporary restriction by flooding the area with a massive, localized surge of oxygenated blood. This physical rush forces the immediate release of nitric oxide from the endothelial cells lining your blood vessels, the exact chemical trigger required for tissue expansion and rigidity. Before I explain the critical breathing sequence that must accompany this physical pressure, I want to take a brief moment to ask for your help. If you are finding this level of medical explanation valuable, please subscribe to the channel and like this video. My mission is to bring this standard of clinical education out of the private office and make it accessible to every man who is silently struggling with these issues. Your support helps this information reach the men who desperately need to hear it. To make this technique effective, the physical pressure must be synchronized with your diaphragm. The pelvic floor and the respiratory diaphragm operate like a piston system. If you hold your breath while applying the perineal pressure, you create intra-abdominal tension, which completely defeats the purpose. As you apply the firm upward pressure for those 10 seconds, you must execute a slow and deep inhalation, expanding your stomach outward. This downward movement of the diaphragm physically stretches the pelvic floor from the inside, opening the muscular fibers precisely while you are applying external pressure to the nerve center. When you release the physical pressure from your fingers, you exhale sharply. This combination of mechanical release and diaphragmatic lifting acts as a powerful vacuum, pulling a fresh volume of arterial blood directly into the local tissue. You should perform this sequence 3 to 4 times in a row, particularly in the morning or before any situation where you require optimal local circulation. For years in my clinical practice, I firmly believed that these mechanical interventions, combined with dietary adjustments, were the only tools a patient needed. I was highly resistant to recommending any form of supplementation. I viewed the supplement industry with deep clinical suspicion, preferring to rely entirely on physical therapy and, when absolutely unavoidable, conventional pharmaceutical medications. I was convinced that natural compounds lacked the biochemical power to enact real change. However, I had to confront a glaring gap in my own clinical outcomes. I noticed that while these physical techniques worked beautifully for many, there was a specific subgroup of my patients, generally men over the age of 55 or 60, who experienced very slow or incomplete responses. They were doing the mechanical work perfectly, but their internal vascular chemistry was working against them. Their peripheral blood vessels were simply too inflamed and rigid to sustain the blood flow, no matter how much mechanical stimulation they applied. This clinical frustration led me to dive deeply into the pharmacological literature surrounding natural vasoactive compounds, looking for a way to support the endothelial lining without synthetic side effects. I eventually found a specific combination that I began to carefully integrate into my protocols. The first component is epimedium. Epimedium contains a compound that acts as a natural PDE5 inhibitor. It functions through the exact same biological pathway as conventional medications, preventing the breakdown of the enzymes that keep blood vessels wide open, but it does so gently and naturally, avoiding the severe headaches and facial flushing associated with synthetics. The second component is alpha-lipoic acid. Alpha-lipoic acid is a profound antioxidant that specifically targets the peripheral blood vessels, aggressively neutralizing the localized inflammation that causes the veins to become stiff and unresponsive in the first place. This combination perfectly bridged the gap I was seeing. Once I began recommending this specific nutritional support, the clinical shifts were undeniable. I distinctly remember observing men in that 58 to 65 age bracket. The ones who had previously hit a plateau with their physical routines, returning to the clinic and reporting a massive return of spontaneous morning rigidity within about 3 weeks of continuous use. It became clear that once we reduced the vascular inflammation and naturally inhibited the constricting enzymes, the mechanical techniques finally had the optimal environment to work. I always ensure that any compound I recommend is rigorously tested, confirming it is free of heavy metals and hidden synthetic analogs. Because I receive so many questions about this, I have placed a direct link in the pinned comment below this video, so you can examine the exact composition and independent purity profile for yourself. When you begin to understand the body through this mechanical and vascular lens, you realize that localized blood flow is never just an isolated issue. The failure to achieve rigidity is the absolute earliest warning sign of systemic endothelial dysfunction. The blood vessels in the pelvic region are incredibly narrow, much smaller than the coronary arteries. Therefore, when systemic inflammation and vascular stiffness begin to take hold in the body, it always shows up in the pelvic tissue first. Ignoring this fading vitality is not just resigning yourself to a compromised intimate life. It is ignoring a blaring alarm regarding your overall cardiovascular integrity. Vitality in your 50s, 60s, and 70s is intimately tied to the health of this vascular network. When you restore blood flow to this specific region, you are inherently restoring the health of your entire circulatory system. One of the most fascinating observations I make in my practice is that when men finally resolve this localized blood flow issue, they almost universally report a sudden increase in cognitive sharpness and sustained physical energy. This happens because the vascular system is one continuous, interconnected highway. When you heal the microvessels in one area, the entire organism benefits from the improved oxygen delivery. We have covered a significant amount of clinical ground today. We dismantled the flaw in relying purely on synthetic pills. We detailed the precise 10-second biomechanical reflex to force reactive hyperemia in the perineum, and we explored the exact vascular chemistry required to keep those vessels open once the blood arrives. Tell me in the comments, have you ever felt this progressive symptom of fading local blood flow and simply didn't know where it was coming from or how to mechanically address it? The human body possesses a remarkable degree of plasticity, an incredible ability to regenerate and respond to targeted interventions. However, this plasticity is not infinite, particularly when it comes to the delicate endothelial lining of your peripheral blood vessels. As the years pass, if these vessels are left in a state of chronic inflammation and constriction, the tissue becomes permanently fibrotic, and the window for natural restoration closes. The nutritional support I mentioned is a crucial part of a comprehensive clinical protocol, designed to rapidly reduce that vascular inflammation so that your body can actually respond to the physical techniques we discussed today. The link is located in the pinned comment below for you to access, review the scientific formulation, and evaluate it calmly. Time is the one variable in vascular health that you cannot negotiate with. The longer you allow the tissue to remain starved of oxygenated blood, the harder it becomes to ever fully wake it up again.